Hello, it's Dr. Garrett Pullman, host of the Prostate Health Podcast. One of the many challenges when considering various treatment options for prostate cancer include weighing the potential side effects that come with therapy. We continue to have new and innovative technology available in helping reduce potential short and long-term side effects. Some men considering the option of radiation therapy may be candidates for a new method that utilizes a water-based gel in helping reduce side effects of treatment. Today, we'll be learning more about this option, so listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is an honor to have radiation oncologist Dr. Xinglei Shen from the University of Kansas Medical Center joining us today on the Prostate Health Podcast. He grew up in the Kansas City area. His background includes a Molecular Biophysics and Biochemistry degree from Yale University. He received his medical degree at the University of Pittsburgh School of Medicine, then completed residency training in radiation oncology from Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. Since 2012, he has been an associate professor in the Department of Radiation Oncology at the University of Kansas Medical Center and leads the genitourinary service at KU Radiation Oncology. In 2016, he began offering SpaceOAR Hydrogel therapy and was the first provider to offer this in the Kansas City area, and around the same time started KU's Stereotactic body radiation therapy program. Dr. Shen, welcome to the Prostate Health Podcast.
Thank you. It's wonderful to be here.
So Dr. Shen, when it comes to treatment for prostate cancer, depending on a patient's risk stratification, men continue to have multiple options, including active surveillance, surgery, and radiation therapy. When men come to you to further discuss the option of radiation therapy, so what are some of the goals of therapy?
Yeah, I think when people come to us, we like to give them a multidisciplinary approach to everything. So almost every one of my patients will have talked to a urologist already. And I think, like you said, men have a lot of different options. So we want to try to do is match their goals of care, what they want out of their care, to the treatments that make the most sense for them. And maybe that's active surveillance for kind of the more favorable risk or low intermediate risk patients, to more aggressive treatment and combined modality treatments for patients with higher risk cancers. I think my job is really to provide information to patients and try to figure out their goals of care and then match whatever treatment makes the most sense for them. And sometimes it's surgery and sometimes it's radiation or the different types of radiation or how aggressively they want to treat with their radiation hormonal therapy.
So what are the challenges of both surgery and radiation therapy, including navigating potential risks and side effects of therapy? So when counseling men and their loved ones regarding radiation therapy, what are some of the potential risks to consider?
Yeah. So, anytime you deal with treatment, you're going to have some risk of side effect. In terms of radiation therapy, generally we'll be treating the prostate gland. And so the structures nearby to that, whether it's a bladder, which sits on top of the prostate, or rectum, which sits behind the prostate, or the urethra that goes through the prostate, all of these organs can be affected by the treatment. So you can have urinary changes, meaning frequency, urgency. You can have bowel changes, again, urgency, erectile dysfunction. And in the long term, there can also be some risk of bleeding from the bladder or bleeding from the stools or erectile dysfunction.
So over the years, physicians who treat prostate cancer continue to hone our craft in minimizing the toxicity of treatment without sacrificing cancer control. As technology advances, we continue to have more at our fingertips to help patients in establishing excellent treatment outcomes. What have been some of the more recent advances in the field of radiation oncology in minimizing the potential toxicity of therapy?
Yeah. So I think if you compare the treatments we do today versus the treatments we were doing just a few years ago. It's very different. Like my own practice has changed dramatically from when I started at KU 8 years ago. So some of the things that are specifically tailored to side effects include the hydrogel, which we're going to talk about a little bit later on also. One of the things that I get asked a lot also is proton therapy. So that's increasingly, more prevalent across the country. And I think there's a potential there for improving some side effects from radiation treatments, although it's not this magical, treatment that all of a sudden you don't have any side effect at all. We've also done better just in terms of our radiation techniques overall in the past, say, 10 or 15 years in terms of image guidance and monitoring treatment during each fraction. So if you look just at the raw numbers from more recent studies versus studies that came out 20 years ago, the rates of side effect you see are dramatically different. And I think this is not necessarily because, I think it's because of the technology we have to monitor the treatments such that we're able to treat the normal tissues to less dose and be more precise about our treatments.
So you mentioned the SpaceOAR Hydrogel. So what is this technology, and maybe kind of explain to our listeners, how does it work?
Absolutely. So this is a really exciting change, in our field. What it is a biodegradable gel. It's biocompatible. I don't think anybody's ever been reported to be allergic to it. It's a gel that we insert directly between the prostate and the rectum. So, we know that the rectum is right next to the prostate, right? Because we do rectal exam, we touch the prostate through the rectum. They're right next to each other, but those two organs aren't physically linked. And so you can create a space between the prostate and the rectum and fill it with this gel, which pushes the rectum out of the way. This gel is temporary. And so during the time that you need the gel to protect the rectum, it's there. And then 6 months later, it dissolves and goes away. And that disappears.
So how is it administered, or how do you get it into that space?
So it's done under ultrasound guidance. So kind of like the prostate biopsies, we put an ultrasound into the rectum to see the prostate. And there's a tiny little gap, a very space between the prostate and the rectum where we thread a needle between there. We use a little bit of water to open that space up a little bit more, and then we inject the gel in there. The way the gel, it's a very clever way they've done it. It's kind of like mixing together epoxy for people who know what that's like. You have the gel itself, and then you have a catalyst, accelerant, and we inject them. The two come out the tube at the same time. They mix together, and the gel sets over the following 10 seconds or so. And so it starts off as a liquid, but when we inject it, it solidifies over a few seconds in that space between the prostate and the rectum.
So who would be an appropriate candidate for the SpaceOAR gel?
So the FDA approval for the gel is for anybody getting radiation therapy. Primarily external radiation therapy, but it's also used a lot in patients who are getting brachytherapy, which is the radioactive seeds. That said, a lot of practitioners across the country, offer the gel for anybody getting external radiation. I've been a little bit more conservative in my practice in that because the original studies showed that the gel didn't affect your cancer control rates, were really only done in intermediate and favorable risk patients. I feel very comfortable offering it to those patients. But patients with a little bit higher risk disease, I counsel them that, we don't really know whether this will affect the control rate, the cancer control rate, that you get from the radiation. And so is the protection you get from it worth the potential risk, maybe decreasing the control rate a little bit? We don't know. We don't have great data on that. And I think eventually we will, over time. But right now we don't quite have great data on that. So I'm a little bit more cautious in offering that treatment to patients with high-risk disease, especially in patients we know there's cancer bulging from the back of the prostate where you're very close to where you're going to be putting that gel.
So what are some of the reported outcomes so far with SpaceOAR in terms of, potential less toxicity and so forth?
Yeah. So in general, it gives less toxicity. I think the best data, of course, is randomized clinical trial data. So the clinical trial that kind of got SpaceOAR approved came out in 2015. It was a randomized trial between standard of care, which is external radiation, and that plus the gel. And what they showed from that study was that it decreased the risk of severe late rectal side effects from 7% to 2%. Wow. So it was about a 70% decrease in the risk of late toxicity. There was also a pretty big reduction in how much dosimetrically, how much dose the rectum was getting. Again, about 70-80% reduction in the dose that the rectum gets.
Wow.
The high dose that the rectum gets.
Yeah, that's great. So with it being kind of a natural gel, does it ultimately dissolve, and how long does that take?
Yeah. So the company, I think, their information that they get says it's guaranteed to last for about 3 months. But clinically, I think it usually takes about 6 months for it to fully dissolve, 6-7 months for it to fully dissolve. And so some of my patients will, 6 months later, they'll say, oh yeah, I feel a little pinch or something back there. And it's probably just the gel dissolving.
Yeah. So, with the numbers that you talked about, that's certainly, great that, we're able to achieve some of those, decreased toxicity and numbers and so forth. So is there any downsides of getting it done? It seems like it makes sense in the appropriate patient.
No, I think, it's really changed practice, right? Because we're doing this a lot more in especially our favorable intermediate risk patients. I think in our very high risk patients, what I worry about putting the gel is that if there's a lot of extraprostatic extension, meaning cancer growing outside of the prostate, posteriorly, right in the space where you put that gel, can the gel potentially push some of those cancer cells away, out of the way of where you would be treating with radiation? Could that hurt something so that's why I have a little hesitancy sometimes getting in high-risk patients. Of course, that's a patient discussion about the risks and benefits of that. The other potential risk of the gel is that you put it in the wrong place. There's a little bit of a skill, like a learning curve with that. So in the first year I was doing the gel, I had one case where I accidentally put the gel into the patient's prostate. It didn't affect the cancer outcome at all. But that particular patient had much more urinary symptoms than you would have otherwise expected because it kind of created more pressure in the prostate gland itself. Sometimes you'll see a little bit of gel extravasate into the rectum, which doesn't seem to make any difference. It doesn't really seem to cause any problems, but those are, kind of show up on the pictures and I guess theoretically may cause some problems, although I've clinically never really seen that to be an issue. The gel will cause a little bit of fullness, so you will feel the gel a little bit. The rectum is a sensor, right, for pressure because it's how you have to go to the bathroom. And so most patients will feel that gel just a little bit. They'll kind of get a sense that there's something there. But over a few days, you kind of get used to it and you just don't notice it anymore.
Well, I think this has all been really great. So in summary, as we conclude the podcast today, is really as technology continues to advance, we have had more options in our arsenal as we treat prostate cancer to help in really minimizing potential side effects of therapy without sacrificing cancer treatment outcomes. So Dr. Shen, any final thoughts today for our listeners?
Yeah, I think a couple of things I want to emphasize. One is multidisciplinary practice. I think it's important for all of our patients to talk to all the different providers, surgery, and radiation when you're thinking about different treatment outcomes and treatment goals. The other part of it is I think the radiation side of things is really changing a lot. What was classically, just a 9-week treatment has just completely morphed into what we practice nowadays. And we're putting more and more of these more precise treatments. We're doing more precise treatments. We're putting these gels in to help people's side effects be less. And a lot of times we're not treating at all, right? We're finding it safe to monitor. So I think we're really improving our cure rates, but also reducing side effects by all these things we're doing. So it's really a great time to, be practicing.
Yeah, it's definitely exciting times. Certainly nobody wants prostate cancer, but again, I think every year we continue to advance with the technology and, like you said, kind of honing in and targeting these areas, but also minimizing side effects. So, well, Dr. Shen, it was certainly a pleasure getting to chat with you today on the Prostate Health Podcast. We appreciate you taking really time out of your busy schedule to visit with us. You've given tremendous value to our listeners in helping empower them. So thank you again.
Thank you so much.
I want to thank you again for joining me here at the Prostate Health Podcast. Subscribe to the show on iTunes, Google Play, Spotify, or wherever you listen to podcasts. And please share it with a friend who may find this podcast helpful. We'll see you at the next episode.